The standard of care is rehabilitation. In days previous, dogs would just be restricted to a cage or a small room for months after surgery. Muscles are wasting away, bones are wasting away, tendons and ligaments are weakening. We want to prevent that process. We want the animal back to form and function as soon as possible. Canine rehabilitation is the state-of-the-art care for our post-operative and chronically afflicted patients.
I've worked in specialty practice in Long Island, New York, and a lot of the veterinarians still are not believers in rehabilitation. From neurologists to orthopedic, they really still are not believing. And I am a believer, and I've seen what can happen when an animal just sits in a crate to heal. The outcome is really kind of devastating. It just where they will be at in several weeks of just sitting.
After an injury or surgery, historically we were neglecting patients in some way. We were resting them, maybe cage resting them. We know more now, we know better than kind of ignoring patients during their recovery period. We can achieve much better results, more predictable results, by overseeing the recovery, the short-term and the long-term recovery of patients with injuries or after surgery.
The nice thing about rehabilitation is that we're able to take a dog that can barely get up and move, or after a very invasive surgical procedure, and bring them back to function and form. It's a very rewarding field, one that involves an entire team of specialists and trained professionals that can provide that care, that extra level to your patients.
And one of our goals as an educational establishment is to help veterinarian clinics treat animals. So overall, reduce the amount of pain and suffering that dogs are going through, and give veterinarian clinics and the rehabilitation clinics the tools to better treat these animals.
I think bringing rehabilitation into private practice will have significant advantages in managing complicated problems like osteoarthritis, or recovering from surgical procedure in a more comfortable and predictable way. I think it also changes the relationship that clinician or clinical teams have with owners. I think they are more connected to owners. They can guide owners more effectively through rehabilitation programs.
Canine rehabilitation can be a practice builder. It can set you apart from other practices in your area. You can provide services that help patients on a daily basis.